Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. Today, a practical tool to reduce disparities in precision medicine. For many patients with lung cancer, access to biomarker testing is still a significant challenge. That's where the 4R Oncology care sequences can help. It's a tool to bridge the care gaps. With us today to share more about the 4R Oncology care sequences is Dr. Tom Lycan. He's an assistant professor of Hematology and Oncology at Wake Forest School of Medicine in Winston-Salem, North Carolina. Dr. Lycan, how does the 4R care sequence address gaps in biomarker testing?
When patients are newly diagnosed with lung cancer, and then as they're going along with their treatments, there's a frequent need for biomarker testing, which is a complicated set of tests that are done either on the tissue that is obtained from a biopsy from the tumor or else from peripheral blood. And these tests are very important to guide treatments. But it's also a complex and scary process to go through cancer care as the person who's going through it and for their loved ones as well. There's a lot of logistics that need to go along with their treatments and all the diagnostic tests that they're undergoing. And it's a lot to navigate in terms of having transportation to clinic visits, covering the costs and the time away from work, and the emotional stresses and the physical symptoms of their cancer and its treatments. So all of these things are summarized by guideline-based care plans with these 4R care sequences pathway, which gives an overarching view of what they're looking for in the immediate future and then also down the road. And it can be a very helpful thing for patients and navigators. And honestly, for clinicians, this is something that when I'm meeting with patients in clinic, it helps me to just point to this and go through and review their pathway with the patient so that I also can kind of reframe everything and how we're coming up with a plan together. So that's really the purpose of the 4R care sequences pathway. One aspect that I particularly like about the 4R care sequences pathway is that it provides information on tests that have not been completed yet, or it gives an opportunity to explain what to expect as next steps beyond the immediate steps. So what I mean is, when somebody's planning to undergo or undergoing treatment, and that's taking place for about 6 weeks, with chemo and radiation, for example, for stage 3 lung cancer, a lot of people feel overwhelmed when they complete that step, and then you're immediately talking to them about the next steps with immune therapy and CT scans and imaging assessments. With the 4R care sequences pathway, it helps to kind of set that expectation of once we've completed this stage, this is what we're looking forward to in the next steps. And so it can really kind of help patients prepare that the next step won't be quite as busy as this one, but there's still some things we need to do. So it does a good job of setting those expectations, kind of setting the table for the future.
Tell us how 4R supports health equity and patient understanding of their care plan.
4R helps patients to navigate the different procedures and tests that they undergo during their cancer treatment because it explains how it's a normal part of their cancer care, and it normalizes and empowers the patient to understand the different aspects of their cancer care and what to expect. And so having that information allows them to better understand what is necessary to make the best possible decisions for them. And it also, at some points, they may see parts of their treatment that they don't think are necessary, or they may identify parts of their treatment that maybe hasn't been discussed before, and they can prompt their clinicians to ask about it. One example of that would be, fertility conservation. And that's not something that is always addressed as much as it could be. And then for some patients, that's not something that's as much of a priority. And so it's maybe something that they can put as a lower priority for them. So it really empowers the patient to kind of triage what is most important to them during their limited time that they spend with their clinicians during their cancer care.
Why did your team choose to implement 4R?
This is a universal problem that's facing patients with lung cancer, as well as the providers who take care of lung cancer. There are an increasing number of biomarkers which are directing first-line and second-line therapies, and understanding the genetic profile of a tumor is something that is going to continue to be a necessity now and in the future for the long term. But at the end of the day, there's only so many cancer cells that are obtained on a biopsy. The patient only has so much time and the ability to undergo so many biopsies. You don't want somebody to go through unnecessary testing. And there's cost constraints as well. So you can't just test every single biomarker that is possible. You really have to focus on what is most necessary. And so determining the right biomarker testing that needs to be done at the right time for each individual patient so that it will actually provide clinically helpful information is an ongoing challenge. And that's something that we are all working towards. Certainly this institution and every other institution that we're working with and nationally and internationally.
Thank you, Dr. Lycan. You can head to the show notes for resources on the 4R oncology model. Until next time, from all of us here at Cancer Buzz TV, thank you for watching.